Hi everyone. Today we'll be talking about the HbA1c blood test and its role in diagnosing diabetes as well as following up patients with diabetes. So what is the HbA1c blood test? Essentially, it's a measure of glycosylated or glycated hemoglobin. HbA1c is produced when hemoglobin in red blood cells, which is the oxygen carrying component, is exposed to glucose in the bloodstream and becomes glycated. As average blood glucose increases, a greater proportion of hemoglobin becomes glycated, leading to higher HbA1c levels. So, for example, in an uncontrolled diabetic, because they'll have increased amounts of circulating blood glucose, there'll be a greater amount of glycation taking place and hence higher HbA1c values when a test is done. It is formed through a non-enzymatic process called glycation, where a stable bond forms between glucose and the beta N1 deoxyfructosyl element of hemoglobin. This chemical process is called the Amadori reaction or Amadori rearrangement. So let's discuss the clinical utility of the HbA1c blood test. This measurement reflects the proportion of hemoglobin that has undergone glycation and corresponds to average blood glucose levels over the previous 8 to 12 weeks, which represents the typical lifespan of erythrocytes or red blood cells in the human body. The key benefit of HbA1c testing is that it does not require fasting and results tend to be more consistent than random blood glucose measurements. HbA1c is helpful for evaluating how well treatment is working. When therapies lower blood glucose levels, HbA1c will also decrease. So, for example, if your doctor starts you on metformin, he may repeat the test a few months down the line to assess your response to that metformin. It is also used to estimate the risk of long-term diabetes complications. If, for example, a patient is consistently above the threshold of 6.5% or 48 millimoles, they may be at greater risk of the micro and macrovascular complications of diabetes. In 2011, the World Health Organization recommended that an HbA1c value of 48 millimoles or 6.5% or higher should be used as a threshold for diagnosing diabetes. Now, when you do your HbA1c test, you may see it being reported as a percentage. This is as per the Diabetes Control and Complications Trial. Or you may see it being reported in millimoles, and this is as per the International Federation of Clinical Chemistry. If a result is greater than or equal to 48 millimoles or 6.5%, the diagnosis should normally be confirmed with a follow-up HbA1c test. However, if the patient has classical symptoms of hyperglycemia like polyuria and polydipsia, and a plasma glucose greater than or equal to 11.1 millimoles per liter, uh, a confirmation with a second HbA1c blood test may be unnecessary. If the repeat HbA1c is below 48 millimoles or 6.5%, this individual should be considered as being very high risk of diabetes. And the HbA1c test should be repeated within about 6 months, or if symptoms appear like polyuria and polydipsia, then you may consider repeating it a bit sooner. People with high normal HbA1c values, typically greater than or equal to 42 millimoles or 6.0%, should be offered lifestyle advice. So, advice on dietary changes, exercise, and aggressive weight loss to prevent progression to diabetes. Finally, let's discuss some contraindications to the use of the HbA1c blood test. Although HbA1c is generally a reliable indicator of long-term glycemia, there are situations where it should not be used for diagnosis, which include children and adolescents who are undergoing rapid growth and puberty, type 1 diabetics, corticosteroid use, or other medications that can influence glucose metabolism, pregnancy, where there are physiological and hematological changes occurring, conditions affecting hemoglobin or red cell turnover because the HbA1c test is based on glycation of hemoglobin. Persons with hemolytic anemia or hemoglobinopathies may have falsely low HbA1c tests. So, for example, in a patient with hereditary spherocytosis, Their red cells may have a shorter lifespan and they may have a falsely low HbA1c test. Some further contraindications would be pancreatic pathology, symptoms less than 2 months duration, and interestingly enough, average HbA1c values vary among different ethnic groups and tend to rise with age, even if glucose values remain pretty consistent. In such circumstances, HbA1c results may be misleading and alternative diagnostic modalities should be pursued, like your oral glucose tolerance test or your fasting plasma glucose.